Good morning. My name is Huntyr Schwegman, and welcome to the continued Spotlight on Education presented by Neosho County Community College, where we highlight various programs and events happening each week at NCCC. And in today's episode, I'll be sitting down with Jen Cain to talk a little bit about the surgical technology program. Jen, how's it going today?
I'm great. Thanks, Hunter.
So Jen, just give me a little bit about yourself. What's your title? How long have you worked here at Neosho County Community College?
So my name is Jennifer Cain. I'm the Surgical Technology Program Director. I'm based in the Ottawa campus, and I am starting my 11th year.
11 years in now, it might be a little bit in the past, but let's talk a little bit about your background in the medical field and what kind of directed you to Neosho County Community College to start education.
Yeah, so it all started back in 2006. That's when I became a surgical technologist, and I am born and raised in Colorado. I went to school out there. I got my first job out there, got some really great experience, and then I moved to Kansas in 2008. And I was working at Olathe Medical Center. And around 2011, these wonderful students from some college called like Neosho something started showing up in the department. And I got to precept them. And over a couple of years, I got to work with some really awesome students. And in 2014, one of them recommended that I reach out to program faculty and discuss educational opportunities because she thought I did an okay job as her preceptor. And honestly, the rest is history. I reached out. A job was open. They offered the job to me. I took it, and I've been here 11 years.
That's great to hear. It's almost like our reputation preceded itself, and you're here now to help us increase that reputation. But
for sure.
For those kind of unaware of what someone in your field does, can you describe on a typical day the life of a surgical technologist? What are maybe some misconceptions people have about the role?
Absolutely. So most surgical technologists work in a hospital or surgery center environment. Surgery is typically scheduled beginning early in the morning, and most of them are completed in a Monday through Friday type schedule. Surgical technologists can work a variety of schedules. They can work 8-hour days, 10-hour days, 12-hour days. It just depends on different factors. But most surgeries are done by 5 p.m. And of course, people regularly get sick or hurt outside of these timeframes. And so it's reasonable to expect nights, weekends, and holidays to be part of the gig sometimes. And each day a surgical technologist reports to work, they'll be assigned to an operating room. And in that operating room, there will be scheduled procedures, and they are responsible for those procedures in the room. So they're responsible for preparing the OR for any given procedure. And they then prepare that room and create sterile fields and get everything organized and ready for the surgeon to join the room with the patient. And then they participate with the surgeon and deliver direct patient care all surgery long. And then once the surgery is complete, they help wrap everything up, get dressings put on, get the patient safely transferred onto their transporting bed so they can go recover in PACU. And then we clean up the OR and make sure that it is ready for our next patient. And then we just do that throughout our day. Common misconceptions are many people think that we are a nurse, or they think that they have to be a nurse or a doctor to get to do what we do, but that's not the case. We are a surgical technologist. We are highly trained to provide direct patient care. We're experts at aseptic technique, and we prevent retained surgical items. And we do all of this in the pursuit of surgical patient safety. So registered nurses and surgical technologists both earn an associate degree in their fields of study, and we work closely together to meet the different needs of the physicians in the perioperative environment.
When talking about the program, what makes the surgical technology program at Neosho County unique, and maybe why should somebody join the program over other programs at other schools, or maybe directly entering the workforce?
I'm so glad you asked that question. So first and foremost, I want to attack the latter part of your question and mention that education is vital for patient safety. Unfortunately, it is possible to join the workforce without proper training or without formal training. And I highly discourage that. All in the name of patient safety. We are experts in aseptic technique. We study the anatomy and physiology of the human body. We study other aspects of science, all in an effort to keep the patient safe. And that's what everyone deserves in the operating room. You wouldn't go and see a surgeon that hasn't gone to medical school. You wouldn't go let an anesthesiologist put you to sleep without going through proper training. You wouldn't even let a nurse in the room without proper training. You need a trained educated surgical technologist in the room. And why should you come to Neosho? Well, because we're the best, of course. But honestly, I think our program is really unique because it does a phenomenal job of building a reliable foundation for students to rely upon when they're in the ever-changing surgery environment. Our program students will gain experience in the clinical setting during their program and continue to attend classes on campus, giving them a home base to return to as they progress through the program. And this produces a well-rounded graduate. These students have both firsthand clinical experience, and then they have almost a year of professional counsel from program faculty. And what we've seen in other programs is that many have models that provide program instruction up front, and then they send their students out to clinical at the end of the program, and the opportunity to provide professional counsel is limited at best, but more often than not, it's completely non-existent. And so that's what makes us so unique.
If I'm looking to join the program and become a surgical technologist, are there any prerequisites I need to have before applying or before joining the program, like healthcare experience or specific qualifications within my academic career or anything like that?
The technical answer is that no, you don't have to have any prerequisites completed, nor do you need to have any healthcare experience in terms of like a previous career. Our program is organized to allow students to complete their general education requirements while learning their new career in an effort to get them into the workforce as quickly as possible. There is a high demand for surgical technologists in the community, and so we aim to provide those to the community as quickly as we can. While, of course, healthcare experience is beneficial, previous college experience is always beneficial. It's just not required for us. However, if you do have healthcare experience, that's a really good marker that helps indicate that this might be the right fit for you because you already have dipped your feet into the wading pool a little bit.
So once I'm in the program and I'm, ready to find my way into this career, how long does the program take to complete? And besides kind of the obvious ones like maybe anatomy and physiology, like you mentioned, what are some of the other classes that might be included in this program?
Grand total, the program takes 2 academic years. If you come in with absolutely no classes under your belt, you will need to take some classes during our summer semesters, but we can absolutely work you towards an associate degree in applied science and surgical technology in 2 academic years. That would be full-time, so you must prepare for that. And the classes that you can expect in the general education portion will include classes like communications classes. So there's interpersonal communications, there's English, then there's some allied health classes like medical terminology and pharmacology. And then our social and biological sciences would include, obviously, anatomy and physiology. I like to tell everyone that's our bread and butter because people don't have surgery if they have healthy anatomy and physiology. But we also are dependent on a good knowledge of microbiology and then psychology and sociology as well.
And once I get my certification and degree, do I have any other options after graduation that I can build towards, higher level certifications or any other programs that I could go on to at maybe a 4-year university?
When you're in our program, you're definitely going to experience a wide variety of procedures because a surgical technologist works with every possible surgeon there is. Every surgical specialty is free game. And our students are going to experience all of those different types of surgeries in their clinical experience with us at a variety of hospitals. Once they have graduated and they've moved on and gained employment, then it's reasonable to expect a graduate to gravitate towards a specific specialty or a series of specialties that they enjoy the most. And so we have seen some of our graduates work as a private scrub for a surgeon. Now, that doesn't generally require any additional schooling, but it is a major accomplishment in your employment history. However, it's also possible that a student or a graduate could further their education and become a certified first assistant, and that requires additional schooling. And then it also requires a surgeon to sponsor you. Graduates who become CFAs ultimately have more privileges than a CST. They usually are permitted to manipulate tissue. They might suture, they might fire staplers, things like that. And then it's also possible that you could transfer your degree accomplishments to a university and you can pursue a bachelor's degree and you can take that and you can move into some sort of healthcare administration if you want to work behind the scenes. Or you could even take it and apply it to a physician's assistant program. There are a couple PA programs in the state of Kansas. We have had a couple of graduates go that route. And honestly, the sky's the limit. You can even take the general education requirements from our degree, apply them to pre-med, and go on up to medical school and become a doctor if you want to.
What type of hospitals, clinics, physicians' offices does Neosho County partner with to secure job placement or internship work for these students?
Our clinical sites, they vary in size. And so we have some really small hospitals and we have some fairly large hospitals. And then a wide variety of surgical specialties are available. Our students will all experience at least 2, if not 3 different hospitals while they're with us. So they get to experience different staff members, different surgeons, and then that wide variety of surgical specialties. And Neosho County is affiliated with all of the major hospitals in Kansas within 60 miles of either campus.
Looking a little deeper into the program and the classwork, what type of technology or equipment are students exposed to in the classroom and laboratory? And are these instruments up to date and pretty reflective of what's going on in the current industry?
Yes. Our students have access to our state-of-the-art simulated operating room where they can get hands-on experience in open and laparoscopic general surgery, as well as perineal and extremity surgery. And our program owns a syndaver, which is a synthetic cadaver, and our students get to experience a surgical procedure on her. And the wonderful thing about her, since she's synthetic versus a real cadaver, is that all of her parts are lifelike. They're the right color, they're the right texture, and there's no formaldehyde odor that you have to overcome. So it's extremely, extremely realistic, and students get to apply their knowledge of everything they've learned in 2D in their textbooks and so forth, and they get to apply it to 3D, which is a surgical patient, essentially, right there in front of them. And they get to explore her abdomen and really get an understanding of the anatomy that is involved in surgery. And then once they do advance into the clinical setting, again, the sky's the limit, because of course we know that technology is ever evolving in the medical field, and our students see things early on in their clinical experience, and they're prepared for it because of the foundation we provided in the classroom.
How does the program stay connected to the developments in the healthcare field, and how do these developments influence your work as an educator?
That's a great question. Our program faculty maintain their certification by completing continuing education credits, and that can be handled in a lot of ways, but we're careful to attend conferences and workshops featuring cutting-edge surgeons in the field. And then we obviously read all of our books, and we update our textbooks as recommended by our publishers, and we're constantly learning right alongside our students.
All right, we've finally gone through all the whole program, finished up all the classes, done the work. So once we graduate, what kind of settings are students going to end up in? Can you share any maybe success stories of program graduates in the past?
So our graduates are by and large going to work at an operating room in a hospital or in a surgery center. And in that vein, they can experience that range of surgical specialties. And we have, the opportunity to work in routine preventative care like colonoscopies and EGDs, or you can work your way all the way up and you can work in trauma surgery. Literally every single thing is available, and the program prepares the student to walk into an operating room setting and be able to hold their own. So, of course, there's always that minor period of orientation, learning a department, learning the people, learning where everything is kept, but ultimately, they're experts in asepsis. They know all of the considerations to be made between a surgical procedure and its goal, and how a surgeon is going to get there. What do they need to do? And our graduates are going to know that information. So our program is extremely proud to boast the 100% employment rate. Our graduates get jobs. They don't generally have any issues in that area. And I've mentioned before that they can become private CSTs, they can further their education. And ultimately, we have graduates all over Southeast Kansas and Northeast Kansas. It is rare that a program student doesn't get precepted by a graduate. And we absolutely love our graduates and the good work they're doing. And we know that our community is in good hands with a Neosho grad in the operating room. And on top of all of that, you can take the CST credential anywhere you'd like in the U.S. All 50 states honor the CST credential without additional training, additional testing, additional fees. None of that's required. You can cross state lines with your credential and work anywhere in this setting. And I have personal experience with it, having been born and raised in Colorado, working in Colorado. And when I moved to Kansas, I just started working in Kansas, and I didn't have to go through any hoops or do anything exorbitant to get a job in a different state. So it's really exciting. And I love seeing our graduates go all the way from coast to coast. We've got graduates in, Arizona and Florida and New York, and it's just really cool.
Yeah, and having that flexibility to kind of move around whenever you need to, or if you have a change in family and you want to move back home closer to where you're from, it's always nice to be able to do that.
Totally. It's wonderful to be able to do that.
Anyway, Jen, I think that's all the questions I had for you today, and I want to thank you again for stopping in to talk to me today. Stopping in, but we're over Zoom. But anyway, thanks so much for answering my questions and teaching people a little bit more about your field and what surgical technologists do.
Thanks. It's been my pleasure.
And if you guys would like to learn more or enroll in the surgical technology program, just visit neosho.edu/surgical to find out more. And that concludes the continued Spotlight on Education presented by Neosho County Community College. My name is Hunter Schwegman, and I'd like to thank you all for listening today. Tune in next week as we highlight more programs and events happening at NCCC. Go Show!